Hi, Professor Darkin class. My name is Savannah Jump, and today I'm going to talk to you about skill decay. So the objectives for today's Tech Talk include describe what skill decay is, describe the importance of skill decay, describe the relationship between skill decay and modeling and simulation, and describe the future of skill decay. Well, imagine you are a nursing leader in the United States Air Force with 10 years of clinical experience, but have not practiced patient care for the last 5 years. As a military nurse, you must answer your nation's call, be prepared to deploy at any time, and treat patients. When selected for deployment, will you have the clinical skills to deliver expert trauma care on the battlefield? Well, the Congressional Research Service reported the principal reason for a military health system is readiness. The Department of Defense Dictionary of Military and Associated Terms defines readiness as the ability of military forces to fight and meet the demands of assigned missions. The military medical forces purpose delivers combat casualty care to support military operations domestically and abroad at a moment's notice, then return critically wounded warfighters home from the battlefield. I ask you, class, Professor Darkin, are you ready? Well, what is skill decay? Well, skill decay is defined as the loss or decay of training or an acquired skill or knowledge after periods of non-use. The longer the period of non-use, meaning not doing that job or just not practicing that skill, the greater the decay. The less exposure a clinician has in a clinical setting, skill decay in clinical performance becomes more evident. Now, these skills can take on the form of physical tasks, which are characterized as those requiring activities such as muscular strength, exertion of forces, endurance, and coordination, or cognitive tasks that involve perceptual input, mental operations, problem solving, and decision making. So why is skill decay so important? Well, the military health system mission states to ensure that all active and reserve medical personnel in uniform are trained and ready to provide medical care in support of operational forces around the world. In order to satisfy the military health system's intent, it is imperative that nurses are competent in clinical skills at home to effectively perform abroad. However, there is a gap between the skills performed in garrison at home versus the skills performed in deployed environments. Some tasks may not be performed in someone's career when they're at home. However, the soldier must remain prepared. Military nurses require strong combat casualty skills because battlefield injuries may include blast wounds and burns. The inpatient workload performed in military treatment facilities that are hospitals located on military institutions or military bases. This workload performed in these military treatment facilities is incomparable to the workload encountered in a deployed or combat location. This lack of resemblance affects nursing skill proficiency in performing surgical skills, responding to mass casualties, and even delivering chest compressions during a cardiac arrest. Skill decay is particularly salient and problematic in situations where individuals receive initial training on knowledge and skills that may not be required to use or exercise for extended periods of time. For example, blood product administration. Nurses are initially trained when they get to the floor. This is a skill that's required when they deploy. However, if that nurse is in a non-clinical environment or an administrative role, they don't perform blood product administration. However, if and when they are tasked to deploy, they are supposed to perform and be competent in blood product administration. So the knowledge and skill retention of clinical skills are crucial for safeguarding people's lives. Maintaining an adequate level of competency over time is key to patient safety. Now, the majority of Air Force nurses, roughly 86%, work in ambulatory care or outpatient clinics. They do not practice at the bedside and are prone to clinical skill decay. The patient complaints seen in military treatment facilities are seldom trauma-related, so they're not using those skills. In 2019, an informal survey was sent out to various Air Force nurses, which they responded and shared concerns that if they were suddenly tasked to deploy, they would not have the most current skills to effectively deliver patient care. Well, how does skill decay relate to modeling and simulation? Well, there's two types of skills that simulation addresses. First are the technical skills, which are acquired during undergraduate and graduate medical education through simulation and supervised clinical practice, so that technical skills can deteriorate as soon as 2 months after training if not used or practiced frequently. Modeling and simulation reduces skill decay in these clinical competencies. Now, the non-technical skills such as decision-making, situation awareness, team working, and leadership are used to underpin the technical skills required for safe and effective practice. Despite high numbers of adverse incidents in healthcare, non-technical skills are not yet widely taught in medical curriculum. Additionally, raters need considerable training to assess and rate behaviors using behavior rating system. Simulation provides the ideal setting in which to examine individual or team skills, especially under stress, like during a mass casualty exercise. So simulation-based education is playing an increasingly important role in healthcare education worldwide to teach invasive procedures initially and to restore decayed performance. To provide adequate opportunities for learners to engage these learning features, they must have access to simulation devices, advanced educational technologies, equipment, mentoring, and expertise to acquire desired clinical performance outcomes and sustainment. The main goal of simulation training programs is to prepare trainees to perform effectively on post-training tasks in a real setting, in a real-world setting. So the various simulation types. There are virtual reality, hands-on learning, role play, standardized patients, task trainers, cadavers, various online presentations, and videos are all various methods of simulation which we have learned throughout our program. Collectively, simulation is visual, interactive, and adaptable to real life. Nurses can adjust according to their facility, training, and patient needs and/or resources. Now, I'd like to point out two types of virtual reality. As you can see in the picture with our Iron Man, Tony Starks. So, augmented reality is an interactive experience of a real-world environment where the objects that reside in the real world are enhanced by computer-generated perceptual information. Basically, these technologies focus on the learner. They can allow for the performance of routine and complex skills where virtual objects can be mapped to and projected over a mannequin and/or a human to perform the training module. Now, haptic technology is that tactile feedback that provides a sensation on the skin. So when you see Tony Starks creating, these different databases and things, modules on the screen, that's a form of haptic technology. It's the manipulation of virtual objects or tactile feedback immersed in a simulated setting that allows master learning achievement. Now, using augmented reality or the haptic technology, it is possible to detect fine motor skills during the augmented reality and haptics-based simulation training and use that data as an indicator for when mastery of a skill level has been achieved. This can be accomplished by data mining fine motor skills from augmented reality and haptics-based simulation training exercises by accurately measuring pauses, smoothness and agility, idle time, and human performance movements in time-space models as compared to expert performance. Confidence and competence of procedure performance can be measured. One study determined that multimedia and hands-on training interventions were equally effective when it comes to the various types of simulation. So the participants' performance scores were statistically more significant in both categories, whether multimedia or hands-on training, than participants who learned just through a lecture only, which is why we know simulation training is effective. Another relation of M&S with SkillDecay is simulation has a safe environment. So with deliberate practice and perfecting skills reinforces nursing competence through persistent hands-on experience. Basically, deliberate practice keeps skills current as performance worsens over time. The psychomotor skills in medicine are complicated and best practiced with task trainers in a simulated environment. Psychomotor skills are any skills that involve an intentional movement. They are distinct from interpersonal and cognitive skills, although it should be noted that proper implementation of many psychomotor skills requires both cognitive and interpersonal skills. It's not enough to be competent at the psychomotor aspects of, say, giving an injection. You also need to be able to communicate well with the patient and use those cognitive skills to correctly carry out the psychomotor skill. So some examples of psychomotor skills include putting in an IV, flushing an IV, giving an injection, setting up a sterile field, and inserting an NG tube. These are all skills that can be formed safely in a simulated environment. And lastly, nurses generally learn from their mistakes, and the goal is for them not to repeat nor have their errors occur in practice. Through simulation education, active learners who seek meaningful learning can practice their skills, make mistakes, and correct errors in a safe learning environment, limiting any risks to patients. And the third benefit of simulation to prevent skill decay is through refresher training. Refresher training aims to reestablish clinical skill levels in a safe domain. A refresher intervention aims to reestablish a specific skill level that was acquired at the end of initial training, which we spoke of earlier, which should be reestablished after a period of non-use in which recall of the skill was not required. Reinforcing consistent repetition and feedback may prevent skill decay. The increased repetitions and practice may provide further feedback to the trainee regarding the correctness of responses and may allow for practice of performance to improve the correctness of the response. Debriefing using video allows individuals to gain insight into their own non-technical skills after a simulated exercise. 2 studies suggested that nurses learned better through debriefing with the instructor or through a machine that objectively corrects skill performance. So debriefs are important. After participating in a simulation, you might receive feedback from the educator, the patient, the simulated patient, or through the voice of the mannequin, or from your peers. This helps to increase your awareness of how you are perceived by others and for you to understand how your skills are developing. Being able to correct and refine your skill development as you progress through your studies helps you to eliminate poor technique or bad habits and promotes positive behaviors and masterful technique. So the literature varies on how frequent interval training should be for simulation or refresher trainings, but infers that refresher training is beneficial. Refresher courses 1 year after initial training are practical, and refresher courses reoccurring under 6 months were found to not be value added. Overall, periodic ongoing assessments are more effective than annual training, but recommending an absolute occurrence depends on the skill, on the clinical skill. So how frequently you need to train through simulation depends on the type of skill, such as the psychomotor skill maybe, that's in question. Despite the frequency, simulation allows nurses accessibility to practice their skills repeatedly in safe conditions. Now, how can we prevent skill decay in the future? Well, Air Force nurses should be competent in their clinical skills to take care of patients when performing their military duties. An equipped Air Force nursing corps is vital to providing effective and timely health care during contingency operations. Skill decay in nursing is attributable to the work settings and type of patients seen within military hospitals. Simulation training is imperative to clinical practice because it combats the loss of skill competence for skills seldom used by incorporating a realism effect, opportunities for performance retention in a safe environment, and through repetitive practice. Good teamwork and communication allow teams to effectively care for patients and is essential to the mission. More simulation exercises should address and observe these non-technical behaviors. More research is also needed to determine what simulation frequency is most effective to sustain clinical competence. Leaders should seek opportunities to identify the frequency of refresher training for combat casualty skills, as these skills are seldom performed in daily operations. Recurrent simulation training enables a ready military force. So, Professor Darkin, class, in the beginning, when I asked you if you were ready, if your answer was no, and you are not ready to deploy, well, you are not alone. Personally, I haven't practiced clinical alert nursing in 7 years, and frankly would have some skepticism if I were tasked. However, readiness is my mission, so I must get and be ready to take care of the mission. Simulation is an effective tool to mitigate skill decay. And in summary, the objectives were that we discussed was the meaning of skill decay, the importance of skill decay and medical modeling and simulation, and how to prevent skill decay in the future. Although I spoke mostly regarding nursing, skill decay is applicable to all professions, and simulation can be used throughout all professions to combat skill decay in that area. If you have any questions or comments, feel free to post them in the class. And here are my references. Thank you, and I hope y'all have a great day.